In this podcast episode, Dr. Mark Hyman welcomes Dr. Elroy Vojdani, a physician specializing in functional medicine and immunology. The discussion centers around the alarming decline in immune resilience and the rising prevalence of autoimmune diseases, allergies, and chronic conditions, particularly in the wake of the COVID-19 pandemic. Dr. Vojdani, whose father is a pioneer in the field of immunology, shares insights into the mechanisms behind these health issues and offered strategies for restoring immune function. Dr. Vojdani begins by explaining the immune system's primary role, to defend the body against threats. However, in modern society, we are constantly exposed to various stressors, including environmental toxins, processed foods, and pathogens, which overwhelm our immune systems. This constant barrage leads to a decline in what Dr. Vojdani refers to as immune resilience, the ability of the immune system to respond appropriately to threats while maintaining balance. The conversation highlights the significant increase in autoimmune diseases over the past few decades. In the late 1990s, approximately 3% of the U.S. population had a diagnosed autoimmune disease. Today, that number has risen to around 10 to 11%, with estimates suggesting that as many as 50 to 60 million Americans may be affected. This dramatic rise raises questions about the underlying causes and the factors contributing to this decline in immune function. A central theme of the discussion is the gut's critical role in immune health. Dr. Vojdani emphasizes that the majority of regulatory T cells, which help maintain immune balance, reside in the gut lining. Therefore, a healthy gut is essential for a resilient immune system. Unfortunately, various factors have contributed to the deterioration of gut health, including the rise in C-sections, reduced breastfeeding, overuse of antibiotics, and the consumption of ultra-processed foods. The conversation also touches on the concept of leaky gut, where the intestinal barrier becomes permeable, allowing toxins and undigested food particles to enter the bloodstream. This condition can trigger an inappropriate immune response, leading to inflammation and autoimmune reactions. Dr. Vojdani notes that the modern diet, characterized by low fiber and high levels of processed foods, has further exacerbated this issue. The COVID-19 pandemic has brought the issue of immune resilience to the forefront. Dr. Vojdani discusses how the virus not only caused acute illness, but also led to long-term health consequences for many individuals. Long COVID, characterized by persistent symptoms such as fatigue, brain fog, and joint pain, has been observed in a significant percentage of those who contracted the virus. Research indicates that 10 to 30% of COVID-19 patients may experience long-term symptoms, highlighting the need for a deeper understanding of the virus's impact on the immune system. Dr. Vojdani explains that the immune system's response to COVID-19 can lead to a state of dysregulation, where some components become overactive while others are underactive. This imbalance can result in autoimmune reactions, where the immune system mistakenly attacks the body's own tissues. Studies have shown that individuals who recover from COVID-19 have a higher risk of developing autoimmune diseases, further emphasizing the need for strategies to restore immune resilience. To better understand the complexities of long COVID, Dr. Vojdani introduces the concept of 5 buckets that characterize the condition. These include viral persistence, superantigen activation, mitochondrial dysfunction, microbiome and gut permeability dysfunction, and autoimmunity. Each bucket represents a different aspect of the immune response and contributes to the overall picture of long COVID. Dr. Vojdani emphasizes the importance of identifying which bucket a patient falls into, as this can guide treatment strategies. For example, viral persistence may require antiviral therapies, while mitochondrial dysfunction may benefit from interventions aimed at improving energy production and reducing inflammation. The discussion highlights the need for personalized approaches to treatment, as each patient's experience with long COVID can vary significantly. The conversation also delves into the diagnostic tools available for assessing immune function and identifying underlying issues. Dr. Vojdani mentions the use of specialized tests to evaluate intestinal permeability, viral reactivation, and autoimmune markers. These tests can provide valuable insights into a patient's health status and inform treatment decisions. In terms of treatment, Dr. Vojdani emphasizes the importance of addressing gut health as a foundational step. This includes removing inflammatory foods such as gluten and dairy and incorporating nutrient-dense whole foods into the diet. He also highlights the role of specific supplements such as vitamin A, vitamin D, short-chain fatty acids, and probiotics in supporting gut health and immune function. For patients with more severe symptoms or complex cases, Dr. Vojdani discusses advanced therapies such as intravenous vitamin C, ozone therapy, and plasmapheresis. These interventions can help reduce inflammation, support immune function, and promote recovery from long COVID and autoimmune conditions. A significant portion of the discussion focuses on the concept of the exposome, which encompasses all the environmental factors that influence health. Dr. Vojdani explains how exposure to toxins, heavy metals, and pathogens can contribute to immune dysregulation and the development of autoimmune diseases. He emphasizes the need for individuals to be aware of their environments and make conscious choices to reduce exposure to harmful substances. The conversation also touches on the importance of understanding molecular mimicry, where environmental proteins resemble the body's own tissues, leading to autoimmune reactions. This phenomenon underscores the complexity of autoimmune diseases and the need for a comprehensive approach to treatment. Dr. Vojdani and Dr. Hyman conclude the discussion by emphasizing the importance of patient education and empowerment. They encourage individuals to take an active role in their health by understanding the factors that contribute to immune resilience and making informed choices about their diets and lifestyles. The conversation highlights the potential for functional medicine to provide effective solutions for those suffering from autoimmune diseases and long COVID.